Now, earlier this year, I did have surgery myself. It was my first surgery. And so I want to take what I learned from that as a firsthand experience to go along with the fact that I am a surgeon, gynecologic surgeon, and I've performed over 1,000 surgeries, helped women through various issues and their not only surgery, but recovery and hopefully being better in the long run, and take all that, both the personal and professional experience, and help you. My name is Dr. Eric Schmidt. I'm a board-certified OBGYN and minimally invasive gynecologic surgeon. It matters where you get your information here at the New School OBGYN, and so stay tuned. We're talking about my top 3 recommendations for helping your surgery and recovery process. As always, this is not medical advice, so please check with your doctor, your surgeon, and get your exact recommendations, restrictions, and compare that with this video to see what works best for you. And most of what I'm going to be talking about is more related to abdominal pelvic type surgeries. And so just keep that in mind when we're talking about some of these things. Okay, a big component before your surgery is to prepare yourself, okay? And I don't want this to be understated because you can do a couple things that might help your recovery, your surgery, your pain afterwards be better. And one of those things, well, the mind is a powerful thing. And so you can prepare yourself mentally. So number one, prepare. And we break that down into 2 separate: mentally and physically. And so again, yes, mental preparation, thinking, okay, well, and knowing that, well, surgery, unfortunately, there's no way around it, that it is a painful event. It is a stimulus to the body that elicits pain. And so preparing yourself, not thinking it's just going to be a breeze, but what I did for myself is think, okay, I'm having a surgery. I'm going to be in pain. Now, hopefully that pain isn't a high level of pain, but I'm expecting at least moderate to high level pain. And so my hope is that I'm just pleasantly surprised when I'm recovering, when I wake up, that the pain actually isn't as bad as maybe I thought it was. Because again, brain's a powerful thing. There's also a number of ways that we can prepare ourselves physically. And so this could be many different things like, well, making sure our heart and lungs are in good working order. This would be things like, if you can, now I understand someone's having surgery, so they may have some limitations prior to it, but if they can, try and really prepare yourself to have a good, strong heart and lungs. And this would likely take months prior to the surgery. It's not something that's just going to change overnight, that you can do a week before your surgery, but, being active, and to go along with the healthy lungs, doing things like quitting smoking will be not only helpful for your lungs, but just helpful all around, because your lungs, they're using their breathing machine to help your lungs expand and give oxygen to your body. And so if by chance those lungs aren't working well, not expanding well because of things like cigarette smoking, your surgery, your recovery might be more difficult. So that is a big point. Also, another big point is to try and keep as healthy of a gut as possible. Now, I think it's common knowledge that surgery can slow down the gut, leading to things like constipation. And so what we want to do is actually prepare the body beforehand, because so many things about the surgery day are going to make it so you're constipated, whether it's you're not eating normally that day, whether it's you're receiving a bunch of medications which slow down the motility of the gut, leading towards constipation. You're going to be dehydrated, afterwards you're going to be in pain. You're not moving as normally as you should potentially for those first few days. And so all those things are going to make constipation potentially a higher chance of happening. And so being proactive, having good gut motility, and doing fiber supplements, moving around, exercise, making sure you're not having bowel movements every 3 days. Instead, it's more of a regular, everyday type thing, is only going to help your recovery. Because I don't want to underestimate how bad constipation pain can be in the recovery period when you're already dealing with enough. Point number 2 we're going to talk about is something called the ERAS pathway. You may have heard me talk about this in the past, but the ERAS pathway stands for enhanced recovery after surgery. And so these are a number of different things that we are well studied to show that you're going to have hopefully a better surgery recovery course with employing these things. And there's a few different components of this. Mainly, there is a big component of what we talked about in number 1 with preparing yourself mentally and physically, but this is more so the day of surgery. There's different medications that often I'll give for my bigger surgeries, whether that's hysterectomy, myomectomy, those type of surgeries, to help the body's initial pain response. Because when somebody is sleeping, there's still that stimulus, which is the surgery, that can tell your central nervous system that, hey, something's happening. This would be painful. And so some of these medications, which I might give beforehand, which would be like Tylenol, and there's an NSAID type medication, celecoxib, which I often give too if someone doesn't have a contraindication to it. It may be even gabapentin is a medication which we often give, again, a nerve pain medication. Maybe you've heard of a aunt, uncle, mom, dad that has diabetes or something like that because they have a neuropathy. This is often a medication used for a lot of different things, but we found that it can be helpful in that pain response during the surgery. So I actually give these medications while you're in the pre-op area so that their body starts using these medications and hopefully improves your pain response afterwards, including continuing these medications afterwards. Next point I want to talk about is your food intake, specifically the day prior, night of, and day of. Unless you have other restrictions that your surgeon is giving you, often you want to keep a normal diet the day before. And then we're actually learning that keeping the gut more in a regular pattern is actually going to help improve the gut and the recovery, decrease things like constipation or issues afterwards. We're also learning that oral hydration with just water or what we call clear liquids would, before the surgery, up until maybe 2 to 3 hours prior to your surgery, is actually a good thing. But you're, of course, going to have to talk specifically about this with your doctor because you don't want your surgery to be canceled because you ate or drank something and they told you not to. So there are some advancements, and so we don't have to keep patients as what we call NPO, nothing by mouth, for as long. And often the best way to recover is to have the least invasive surgery as possible. And so least amount of injury to the surrounding tissues, hopefully less pain, better recovery, less areas your body has to heal. So I'm going to abbreviate that MIGS, minimally invasive gynecologic surgery, is really what I strive for, what I try to do for all my patients. Sometimes it's not possible. If there's situations like cancer or things like that, this may not be possible. But for almost all cases, including things like large fibroids, endometriosis, which traditionally maybe for difficult cases actually had to be large cut surgeries, these days, these hopefully can be done with just the small cut surgeries or even vaginal surgery, which is one of the best minimally invasive surgeries because there's no cuts on the abdomen. So talk to your doctor about the route of surgery because it matters. Last point we're going to make, nausea control. And so some people know that they might get more nausea with surgery medications, or maybe they're more prone to nausea and they want to be more preventative for nausea. You can talk with your doctor and your anesthesia provider about potentially getting you some preventative medications. Now, they usually do use a few preventative medications, but they can potentially escalate that, give you a couple more medications that might help with your nausea because no one wants to be throwing up, doing that Valsalva, using those muscles after they just had their surgery. And so talk with your doctor and your anesthesia team to see if you can get some nausea meds for helping your recovery. And my last recommendation, point number 3, is movement is key. And what I mean by that is, again, you're talking to your doctor, you're listening to what the exact restrictions are, but often it's not meaning like, hey, you should be in bed for the next few days after again, we're going to make the example of hysterectomy. I'm often encouraging my patients for a normal hysterectomy with no issues that even the day of surgery, you're going to be going home for the comforts of your home and bed, but I do want you moving around even though it's going to hurt. Okay, because moving around just lightly around the house, maybe with a little bit of assistance if it's that first day, is going to be good. And so I hate to see the stories of people where it's like, oh, I finally got outside after a month after my hysterectomy or surgery. And really, and they say, oh, I only made it to the end of the driveway. No, I want you potentially doing that in the first few days after the surgery. Now, of course, listen to your body and everything and your doctor and your surgeon. But often we learned through studies that movement and being more active after your surgery is actually going to help your recovery in the long term. And because sometimes if we just lay there on the couch or the bed, kind of in a protective position to where that injury was at surgery, it might cause more spasm because when you get up, you stretch those muscles. It's going to hurt. But if you're doing that from the get-go, there's less of a chance that those muscles, the brain is going to be just trying to protect that area. You kind of have to let your body, let your brain know that pain's okay. And so if you're walking around with like a 6 level pain, 7 level pain after surgery, just with movement, I often say sometimes that can be normal. But again, talk with your doctor. That's just what I talk with my patients about. And actually, it helps them quite a bit in the long run, and they're having really great recoveries. And then often, hopefully over the next day or two, after their surgery, they're just doing little walks outside, doing walks around the block potentially after a few days after surgery. And so everyone's different. Everyone's pain perception is different. But no matter what, these things hopefully can help your recovery afterwards, making it so this surgery doesn't put you down for so long, and you can return to hopefully normal life sooner than you expected. And that's the whole point of all this. I hope you guys enjoyed this video. Let me know if you want some more surgery recommendation videos. I just thought, after personally going through a lot of this and it being my profession, this could be helpful. All right, guys, have a good day.